Hello, Dr. Paul TEICH here with a health tip today on DMSO. Now, I'm not going to say where I get this from, as I'm not performing a product placement here. I am merely lecturing on the effectiveness of an alternative healing method, which I did lecture at a number of years ago at Abington Hospital in Pennsylvania. Before the nurses, I lectured on alternative healing methods, including acupuncture, needleless acupuncture, chiropractic, yoga, Reiki, and massage. Today, we're only lecturing about DMSO, dimethyl sulfoxide. First, of course, don't use anything unless your medical doctor has okayed it. I do have to warn you that if a doctor recommends DMSO for anything besides interstitial cystitis, a painful condition of the bladder, the doctor is at risk of losing his license. In short, there is a wonderful book called DMSO, written by Dr. Morton. I recommend that book. DMSO is an adjuvant. An adjuvant is a chemical that allows anything you mix it with to pass right through your skin into your blood. So where some people mix DMSO with peppermint oil or lavender oil or eucalyptus oil, I never mix it with anything directly. If I did, I would only mix it with 100% pure or 99.99999% pure medical grade essential oils. I take a full complement of vitamins, so using DMSO for pain, I don't mix it with anything. I actually take it and put it in a glass spray bottle, which I got at Whole Foods. They're $10. And that keeps it, very pure. It has a very long shelf life. I actually buy it by the gallon, and when I get it, as you can see, this has a little aloe plant on it. I get 99.999996% DMSO, but mixed with 30% aloe. It's 70% pure DMSO and 30% aloe. So I don't mix it with anything. I want the healing effects and free radical scavenger effects of DMSO. Wherever you're in pain, you have massive amounts of free radicals being produced and hanging out around there and contributing to the pain and inflammation process. DMSO destroys that. I used it with 30% aloe because DMSO, made from trees, discovered 100 years ago in the paper-making industry by accident in Russia. It's one of those things that seriously decreases pain, seriously decreases inflammation, seriously speeds the healing process. The drug companies don't want you to know about this. I want you to know about it. I want to be able to sell it, but because I'm a doctor, I'm not allowed to. They have ordered the American Medical Association to remove my license. The United States government will remove my license if I sell this to you. Aloe is one of the most healing substances known to man, and I want to use the adjuvant properties of DMSO to drive that aloe into my blood, which I normally just spray it right on my wrist and then rub it together until it disappears, as you need to have your skin perfectly clean when you use it. You cannot have used soaps, lotions, potions, deodorants, anything that smells. You can't use anything. Your skin has to be totally clear. You should wash it off very strongly, maybe even with alcohol, and then wash it off with water and scrub it. And then once it's dry and your short's totally clean, spray your DMSO. I use 70% DMSO, 30% aloe. That's what I mix it with. Were you going to mix it with anything, man, you better make sure that was medical grade, which is very expensive, and you really have to watch where you get stuff. So this DMSO is from a company that, of course, is run by a professional chemist who knows about its healing qualities and even has to say in its literature, this is not for medical use. This is used very often as a veterinary product. If you're friends with one, you can get one from a vet. A vet will sometimes give it to you for your pet. if he gave it to you to help you, he would be at risk of losing his license, United States government, American Medical Association, and so forth. So we have this product used very often by weightlifters, bodybuilders, dancers. I myself, 20 years of martial arts, 6 years of full contact ninja training, very hard. Many people will take this and rub a small amount of it. They may put it in a dropper. I chose to put it in a teeny little spray bottle. I will even tell you my dogs live longer than normally. I had a 14-year-old bulldog. Look how old they live. And I nursed her through a stroke. I now have an 11-year-old bloodhound. I use it on him, actually, to clean his ears. I spray it in his ears. Hound dogs, they get very black ears on the inside. Of course, don't do this without your vet's okay. And then I wipe it out with paper. So, important things to know about DMSO is that actually the preferred method of drugs transmission into the human body today is transdermal, which means across the skin. So likely one day you will not be taking pills and will be taking less shots even, that everything will be put right on the skin with a patch with something like DMSO mixed in it, and it'll go right into your blood and won't have to go through your alimentary system and hurt your stomach, and all that. Imagine being able to take aspirin, but you didn't have to swallow it, so you didn't have the negative side effects in your alimentary canal and system of taking aspirin. I do have to say, this is a fabulous product. It has to be used, very wisely and carefully. It's one of those things that I would say this should be used by a trained doctor, but doctors don't really use this on humans. Only, as I said, for interstitial cystitis. It is the strongest antioxidant that we have been able to find. I have read even more than alpha-lipoic acid. So I put it on my wrist. It goes in my blood and travels to the area of pain and starts causing less pain. It has also been found to have antidepressive effects. When I was hurting very, very badly, I took tiny drops of it and put it under my tongue. You really have to be tough for that. It tastes like turpentine, as it is a solvent. It's an organic solvent that has to be treated very, very carefully. What else can I tell you about DMSO? When you mix it, which you wouldn't be, with a chemical, it multiplies the power of the chemical or drug by 10 times. So you would need 10 times less of most medications if they were mixed by DMSO and put into your body. That's one of the big reasons the drug companies don't want you to know about it, because it would cut down their profit by as much as 90%. It has been found in other countries that if someone is having a stroke and you give them DMSO, immediately the effects of the stroke are extremely less. In fact, I have nursed 2 dogs through strokes. One, a 9-year-old bulldog, which she was mostly better from the stroke in 3 days, and another, a 6-year-old bloodhound, my dog Lucifer, which is on this YouTube under my animal folder as Dog After Stroke, days 1 through 14. We did give him multiple treatments, including chiropractic adjustments, acupuncture, DMSO, every day, and coenzyme Q10 and cold laser therapy. However, was I not a doctor and did I not have some of those other talents, I could have just used DMSO and coenzyme Q10, and those 2 amazing products would help a lot of people with a lot of problems, including stroke. Of course, don't do anything without your medical doctor's okay. After about 3 weeks, after a moderate to severe stroke, most people would put the dog down. My dog Lucifer is now running and catching balls and almost the same as he was beforehand. I have used this product as much as every day, and with severe injuries, I have used it every day for 3 months. You wouldn't want to use any, particular product unless it was a vitamin like CoQ10 or something like that. This may be safe to use every day for the rest of your life. I personally wouldn't recommend that, but I have used it every single day for as long as 4 months and have had no negative side effects, as it is an extreme antioxidant, as we have many other antioxidants like alpha-lipoic acid and coenzyme Q10 and vitamin C and vitamin E. This is just the strongest of all of them. I have even known a patient who consulted me and another doctor. They had a terrible rash that was oozing extreme clear liquid all the time, wouldn't stop itching. So this person could have gotten a Medrol dose pack from the hospital, but had no health insurance and could not go to a doctor. So they used Clorox wipes to clean it, which has Clorox in it, which is known as Benedict's solution in the hospital, and then would clean off the Clorox and would put DMSO on it. And from something that didn't clear up for 2 weeks, it began to clear up immediately in 3 days, using the Clorox wipes as a cleaning agent and the DMSO as a healing agent. DMSO is an extreme healing agent for sore muscles, hurt muscles, sprains, strains. I had scalded my hand, and making bacon, hit the pan, and the grease went on my hand, and my hand bubbled up. I had terrible second-degree burns. At the time, no health insurance. Couldn't go to the doctor, couldn't go to the hospital. So I actually took butcher's bacon and wrapped it around my hand to start replacing the fat that came out of my hand. And then I would soak my hand in Bragg's apple cider vinegar, and then I would spray it with DMSO. After a few days, it looked better than anyone could possibly imagine, and I started filling up a quart Chinese food soup container with DMSO and soaking my hand in the DMSO. Eventually, all the bad skin fell off, and I was actually working within 5 days. And had I gone to the hospital and they treated it and wrapped it. Now, don't do this without asking your medical doctor. However, if you're in a situation where you have no medical doctor, you can't even call one for advice, you're perhaps going on the internet trying to find out what to do, I am just telling you what I did, personally, what worked, and not even recommending it for you. Always ask your medical doctor first. So, sprains, strains, chronic pain, arthritis, basically wherever you're having pain, you could put this on that area, or you could spray it on your wrist, because arteries and veins, they're really good. Rub it in. It penetrates all the way in, right through your skin into your blood. Again, mentioning, make sure the area is totally clean and there are no chemicals around you. Do not wash this off with soap. The soap will go right into your blood and cause serious problems. That's why something like this should be handled by doctors and physical therapists. It can be bought by anyone. And be very careful that it's 99.996 at least % pure DMSO. Get it from a company that is run by a real chemist. I get it mixed with aloe on purpose, and I don't mix it with anything else. By the way, I might get a gallon like this for less than $200, and I might get an amount like this for $35 in a health food store. So I use a lot of it. As you can see, this gallon was full when I got it. I have only used it on me, my dogs, and that's all I can say right there. This should extremely be known about. It is even one of the things that could cause anti-depression in a lot of people that have it, although we worry, since they are also on one or multiple medications, can they even use something like this at all, because it might multiply the power of the drugs that they're taking. So it's like, if you're on any drugs, don't take DMSO. If you are someone who does not take drugs, it would be a better product for you. I mean, God forbid you take any chemical recreational drugs and DMSO. That might freak you out. The answer might be death. Please don't do that. Let's see, we have covered what it's used for. Pain, mostly making things heal more quickly. Have even known people who thought they had to go to the hospital because they thought something was broken, which is a good idea, to always go to the hospital in that case. Whatever is going to happen with billing, used DMSO and anti-inflammatories, which DMSO is one also, and ended up fine in the end. There are certainly times when you need to go to the hospital. Certainly, it is a shame that in America, health insurance isn't free. I so wish my parents would have moved to another country so I wouldn't be laden with debt from school and having to pay for health insurance. I haven't had it myself for 10 years. Health insurance, that is. Don't use drugs with this. Make sure your skin is completely clear. Use it for any type of pain. Keep it out of your eyes. Keep it out of your ears. If not, as pure as it could be, it would then have acetone in it, which is cancer-causing and destroys your liver. That's why I get it from a company that's run by a true chemist and medical grade 99.996% pure. One of the big complaints with it is that it makes you smell like garlic or fish. I would rather that than taking any type of terrible drugs. It's my opinion that many of the pain drugs are terrible. That's pretty much. Oh, it also can dry out the area that you put it on. If you're using it often in the same area, you don't have to use it necessarily on the area that hurts. As if you do it as I do on your wrist, it's going to go all the way through your blood. But it can make you smell like garlic or fish, some people say, and it can dry out the area, which the aloe helps. And you could get pure aloe, and after you rubbed it in and it was all gone, you could rub a little pure aloe on there. Or you could get some very high-grade vitamin E and put that on there. Aloe, vitamin E, coconut oil. Very good coconut oil. Once the area is dry, you could put a couple drops of coconut oil and rub that on it. It won't matter. Coconut oil is extremely good for you too. So this is my segment on DMSO healing. And I hope it was interesting to you. Dr. Paul TEICH out. Thank you. Have a wonderful day.